big sort of COVID stories. We'll also have another Doctor Who, but we're starting with something very different tonight. And what an honour to have this guest at this time of night on BBC 5 Live. And it's off a story that really caused headlines this week. An 88-year-old woman from East London received a bionic eye. See, from your point of view, you go from science, Chris. From my point of view, and a lot of other people agree with this listening that don't know science and medicine, when we see the word bionic, we're interested, right? If you want to get a message out there, just put the word bionic into it and we're there, right? We're interested straight away. And this is that a woman from East London, said 88 years old, had a bionic eye implant to help partially restore her vision. And Chris and I wanted to find out all about it. And we can welcome to the show Mahi Muqit, who is, and I don't even know if I can say this right, a consultant vitreoretinal surgeon. I hope I got that even close, at Moorfields Eye Hospital, who led the team that did this. Mahi, welcome to the programme.
Good morning. Good morning.
How close? Vitreoretinal?
Yeah, you got to kind of say it a bit more smoothly. Vitreoretinal.
Vitreoretinal. Yeah. There you go. I'm getting smoother every single time. This is a real before, during and after thing. And then I'm going to let Chris loose on you. But just tell me the build up to this and the excitement, I suppose, with yourself and your team as you work towards carrying out this operation.
Yeah, so thanks for the invitation. Yeah, with clinical trials, there's a huge amount of preparation, especially with international clinical trials. So this has been run across Europe. So we obviously have to find patients who are interested in participating, and that itself takes quite some time to get the right patient. And I also have to receive specialized training in the surgery itself, although I've been involved with it for many years. So that involves traveling over to France, which is difficult during the pandemic. So, and there are many people involved. So it's quite a complex process with these types of trials, but we finally got there in December.
Wow. So you're building up to this. Excuse my ignorance. So you're in the operating theatre. Are you operating directly in the eye?
Yes, I'm the actual surgeon, and we're doing the operation. The patient was asleep in December, and we have quite a number of people in the operating theatre who are helping with the operation.
Yes, but you're the main dog here, and you're the top dog. What did you feel like in terms of this being your life's passion, your vocation, your work? Waking up that morning knowing that you would be leading this operation.
Well, I'm sure Chris will also appreciate this. Is a certain times in your work you do feel quite relaxed, and especially when I'm operating, I personally do feel quite relaxed. So when you're actually starting the operation, you just slip into the zone, and you've done this many times before, and then the actual operation, the complexities, you've been through it. Obviously on loops before the actual procedure. So actually it's quite a calm environment. Yeah, everything went very smoothly. So yeah.
Mahi, can you take us inside the operation, talk us through what you did, and don't spur the horses in this, because we got this very inquisitive, wonderful late night audience who would love to know, because all I know is, microchip in eye, that's it. But can you talk me through the actual technique and the physicality and practice of what you actually did?
Well, if you take the part of the eye that we're concentrating on, it's called the retina, which is the inner lining of the eye. So they call it a light sensitive film. And at the very center is something called the macula. And in this particular patient who has dry age-related macular degeneration, the center of the retina, that is the macula, has a large area which is missing important cells. So that's the target for the electronic chip. So in order to get the chip into the macula, you do an operation called a vitrectomy. A vitrectomy is an operation that's widely carried out in eye units. The eye is full of a jelly. It's a bit like egg white. So you make some little micro incisions, you remove the vitreous jelly, and then you access the area of interest called the macula. And then there's different techniques you use to create a specialized trapdoor, like a small window in the macula. and that's where you post the 2mm by 2mm electronic chip, which looks a bit like a tiny SIM card. It's very delicate, very light, very fragile. So we have a special protocol that we follow to ensure it safely gets delivered. And we have a special instrument that we've designed with the company to help deliver the chip and it docks in the correct location.
Mahi, I'm on the edge of my seat here. So operation ends. There must be a euphoria there, because even though you say you're calm and you've been through it, you know what he's doing, there's still that it's there. There's been nothing that's happened untoward or unexpected, and it's done. So talk me through that, the minute you sort of, what do you call it, scrub down, scrub up, scrub down, take your, and also then what's happened since, and what is the process after, and when you kind of know what's it done so far, and what is the time period before you know how successful it's been?
Yeah, I mean, when you finish the operation, the first thing you think about is that everything has gone with no complications whatsoever, and that's a primary objective, is to do the operation with zero complications, and that was achieved, and then it's a case of actually making sure the patient is monitored over about a month, and that was over Christmas actually. Mm-hmm. So they were always in touch with the research team. Any problems at all, we have a hotline, and fortunately she had no problems at all. It was very smooth recovery. You're always thinking that things can go wrong, but actually it was completely fine. And then when I saw her after the new year, you have a look in the eye and you see the chip sitting there with no issues at all. So you're very pleased.
And how's it changed her vision then?
Well, the thing with this particular clinical trial is that she's at the very beginning. So what happened last week was the first step of the trial, where we actually switched the device on. So we've implanted the chip in the eye, but we don't know if it works yet. So this week we tested it, and it was actually working. So we spent a lot of time in the hospital with our technicians, and now that we know the chip is fully operational, she's now going to embark on some specialized training at Moorfields with our team, who are going to help her understand this new vision and use the chip. And only then will we know later what she will see, and that's part of the clinical trial.
Mind absolutely blown. This is, if you're just tuning in, we're able to ask the lead surgeon about the operation that you read about the 88-year-old woman in East London who's received this bionic eye implant to help partially restore her vision. Learning so much about this. Let me bring in Dr. Chris Smith, because there was probably nothing hugely technical I asked there, but I'm sure this story intrigues you so much, Chris. So fire away.
Maya, I'm intrigued. How does it work? How does it actually restore vision to this person?
Yeah, so it's actually a bionic vision system. So the chip is just one part of it. So the patient has to wear a specialized pair of glasses. So when the patient's walking around normally in daylight, the chip is not activated. When the patient puts on these special glasses, that's when things start to happen. So over the eye that we've implanted, there's a special video camera, and that captures the visual scene. So if she's looking at something, it'll scan that image. That's then sent from the glasses to a small computer, which is sitting on her waist. But like I mentioned, it's like a large Walkman from the 80s. And then you have some artificial intelligence algorithms, which then filter the signals, clean the actual signals, and then send that information back to the glasses. And then infrared beams then take the signals and are then beamed into the chip, which then fires up and is activated. And the electronic chip in the eye then processes those signals and transmits it to the optic nerve, to the brain. And then the patient can start to interpret the image.
Wow.
Does the chip have its own power supply, or does it use the signals coming in from the glasses to make the electricity that it then injects into the optic nerve to send the signals to the brain?
That's what I was going to ask.
Yeah, exactly. So I've worked in chips before, which were connected by various wires around the eye. But this one is quite unique because it's completely wireless. So the way it operates and is charged is by the signals coming from the glasses. So that's how the actual circuit opens up. Yes.
Wow.
It's infrared, isn't it? It's basically heat that you're sending in. No chance of cooking the person's eye by accident with the glasses.
Well, that's what they spend 5 years in Stanford and Paris and sending all the information to make sure it certainly doesn't do that. So they do lots and lots of testing, safety testings, and the MHRA's obviously assessed all this and made sure that that's all absolutely fine. So we've never had any issues with that at all. No.
And obviously the crucial question, though, before I finish, Colin, and hand the baton back to you, is what's the resolution of this? What's her acuity? You know, if you were standing in front of that chart with the letters and numbers on it, what line would she be able to read with this compared to before? I mean, obviously before, if she had macular degeneration, I think that's what the diagnosis was, she wouldn't be able to see very much. But what line on the chart could she read with your device, do you hope?
Yeah, so at the moment she can't see the chart. She's got, you would probably call hand motions vision. So when you can't see the chart, you start placing your hand over someone's eye, or you place fingers, and then you shine lights, and that's where you have very poor vision. So she's in that range at the moment. There was a study carried out in Paris with Dr. Lemaire's team. I was kind of involved with that study, and the first 5 patients were able to see letters and words using this device consistently. And what we found over the years following those particular patients were that we're expecting potentially up to 2 lines of vision. Wow. Which hasn't really been demonstrated or shown in any electronic device in the past consistently in a study. And we've also been observing that using special applications on this system, there is potential to improve further. So this is why we're now rolling this out across Europe in many centres, so that different surgeons, different patients, you can then look at it and see all the results and then validate that actually the vision can improve to a good level. So that's the hope.
And just black and white, is it, at this stage?
Yeah, exactly. Yeah.
We should point out, in terms of when you talk about dry AMD, some 12% of people who reach the age of 80, over the age of 80, are affected by this. So it's fairly commonplace, over 1 in 10. But we shouldn't lose sight of what this means. A lovely quote from your patient who said, I'm just excited at the prospect of enjoying my hobbies again. And, for all this work and all the technical speak, I kind of think, Mahi, that's the most beautiful part of it.
Yeah, I think, I spend a lot of time meeting patients who are blind with macular degeneration, and you really have a chat to them about what they would like from this particular device. And everyone has a different story, and everyone has a different situation. And when you get, as you get older as well, having very, very poor eyesight really makes you a bit isolated, and your mood drops. So starting to see, even catching, the small objects in your field and seeing familiar objects and faces really does bring a significant quality back to your life. So that's really the aim here, is really, and also, you're quite surprised that, we've got a very elderly patient group, but the ones I'm meeting are very, very motivated to come on a 3-year trial. People used to think that, with the pandemic and going outdoors and traveling to hospitals, but the patients I've been meeting are very, very determined to get involved with this type of research. So it's very encouraging.
And the sky's the limit. I'm sure there's so many other projects as well you're working on, because also, same hospital, not that long ago, there was a gentleman who was the first person in the world to have a 3D printed prosthetic eye. So so when this happens and you see success, and hopefully success right through to the end of this, it must just give you a great tonic, because this isn't easy, just to keep working as hard as you are when you see so many amazing steps forward.
Yeah, I think I said in a previous piece that in the last couple of years, I mean, I've seen, so many new therapies become available. We're actually in conversation with patients and signposting patients to things like gene therapy, signposting them to stem cell transplant trials at Moorfields. We've got a good group of very talented doctors at Moorfields who are running these trials, and we now have this available. So yeah, it's very good for patients, because before, these are all untreatable conditions, unfortunately, but now we're really looking to bring patients back into the hospital, into these important trials.
Well, listen, thank you so much for staying up so late for us to tell us that story, Mahi, and it's been brilliant. We were talking about it earlier in the week, and just to get that first person insight was just fantastic and perfect for a midnight medic. So thank you so much. You sleep well.
Cheers. Thanks very much, guys. Thank you.
There you go.
Good night.
Good night.
Vitreoretinal surgeon, consultant vitreoretinal surgeon. See, look how smooth I'm saying it now. At Moorfields Eye Hospital, who led the team, Mahi Muqit. Thank you so much for that. And Chris, I don't have expertise in this, and maybe I'm pushing you here in a direction that we ad-lib a lot of what we talk about. But I look at hearing aids and the advancements that's been made. I know someone that, rather than it being their ear, it's screwed in, little ones screwed into their head, behind the ear.
Well, you picked up on this word bionic earlier, and actually it was the Aussies who invented the cochlear implant that you're referring to there, that called it the bionic ear, and restored hearing to people who previously were beyond the reach of hearing aids. Because the way a cochlear implant works, it's sort of similar to what's been done here with vision, which is that in the ear there is